I welcome you all to today's session. Myself Rajita, and here in this session, we are going to continue the discussion regarding the aging process, age-related problem, and gerontological nursing. As we have discussed the basic concept of aging process, we have also learned regarding the demography of the aging or old age people in India. We have seen certain factors, positive and negative factors, which often influence the process of aging. Now, here we are going to discuss regarding the age related physiological changes. Age related changes are common and it affect every body system. Now, these changes are normal to occur in our old age people. So, as our medical professionals, it is our role to learn about the normal physiological changes. Why it is important is because once you are in clinical setup, while assessing our old age people, if you are learning regarding the normal physiological changes that will be present in individual, you will be very simply differentiate between the pathological process or a physiological process that is occurring in an individual person. So that is how, as a medical professionals, we will be able to recognize early if a client or if a old age client is suffering or developing with certain disease process. So let us study the result of assessment and the basic of the physiological changes that are commonly found among the old age population. So here we're going to discuss regarding specific age related systemic changes which are being found on our physical assessment. So first let us start with the visual system. So in visual system, often for our old age people, we are going to see or we are going to see the changes into their eyes, even eyebrows, even their eyesight. So first we're going to see in an old age people or in an old age individual, the eyebrows and eyelashes often will be losing the pigmentation of the hair, and that is the reason there will be graying of the eyebrows and eyelashes. Now it is a very common phenomena that is found on a old age individual, but if it is found in a younger adult, it is a risk or it is indicating that the person is suffering from certain disease condition. But for a old age person, it is very oftenly seen that they will be having loss of pigmentation from the eyebrows and eyelashes. That is the reason they will be present with grayish discoloration. The next comes the eyelids. So often we are going to see the older people will be losing their orbital fat and there will be often decreased muscle tone. That is the reason most of the old age people will be present with mild ptosis. Even there can be presence of or development of ectropion and entropion. It is very commonly seen among the old age population. Now it is considered to be physiological, but once it is affecting the normal visual system, then it can be considered as a sign or as an indication that the person is suffering from certain disease. Until and unless it is causing some disturbance in the body, we are going to see mild ptosis. Entropion and ectropion are very common feature found among the old age people. For some older individuals in conjunctiva, we are going to see the presence of small yellow spot. Now, it is considered that this are very normal among the older individuals, and it can be caused because of chronic exposure to certain rays, even ultraviolet rays, and as a process or as a normal process of aging. So yellow discoloration over the conjunctiva is considered a normal finding among the older individual. Next, we're going to see the changes which will be occurring in the sclera as well. In sclera, in case of an older individual, we are often going to see the presence of lipid deposition. So, sclera color will be turning into yellowish as opposed to bluish coloration. So, that is the reason, because of the lipid deposition here, there will be color changes, and it is considered to be a normal finding for old age people. Next, we are going to see the cornea also will be going under certain change with the aging process. Generally, we are going to see atrophy of the nerve will be very commonly seen in case of a old age person. Decrease in the water content or fluid content inside the eyes or in the cavity also causes decreased corneal sensitivity and corneal reflexes. So often with our old age people, if we are performing the visual sight examination or an assessment of the visual air system, we are going to see the corneal reflexes and the corneal sensitivity will be much decreased for those people with old age. Now here, accumulation of lipid also can be taken place in the cornea with the aging process. The deposition or accumulation of the lipid ultimately will be causing blurring of the vision of individual. The next comes cholesterol deposition in the peripheral cornea often will be noted, which will be ultimately causing a milky white gray ring over the eyes. That is when a person will be suffering from arcus senilis. So that is how it is a very common and normal finding among the older individual. Now it is affecting the eyesight of the individual. We may go or we may suggest them to go for a medical or surgical therapy to clear the arcus senilis. Next one is the changes related to the lacrimal apparatus. We are often going to see there will be decreased in the tear secretion will be often noted among the older individuals. Dryness and tearing of the eyes and irritation of the eyes or the malposition of the eyelids often will be commonly found or commonly assessed among the older individual. So we are going to see there will be increased rigidity of the iris within the eyes. That is the reason often the pupil size of the individual will be decreased here. Loss of pigmentation will be present. So iris color will be changed with the aging process. Ciliary muscles also will be becoming smaller. So that is the reason often we are going to see the near vision of the individual will be disturbed. Even accommodation of the eyesight will be disturbed with the aging process. Pupil recovery will be very slower if exposed to light. So these are the common changes along with the visual system we are going to see along with aging process. Now we are going to see the changes which will be occurring into the lenses. So definitely we are going to see the biochemical changes will be taking place in lenses. Basically here we are going to see oxidative damage will cause the formation of cataracts. So that is the reason why almost all the old age individual will have to go for a cataract surgery, because it is a very commonly found that the cataracts will be present for every individual. Now there will be increased rigidity of the lenses as well with the aging process. That is the reason the person is more likely to develop with presbyopia. There will be retinal changes. Basically, the retinal vascular changes here are very common. There will be decreased in the cones. So that is the reason there will be changes into the color perception for a particular individual. Loss of photoreceptors are often visible or often seen among the client. That is the reason there will be decreased visual acuity with older individual. Vitreous humor can go for a liquefaction, even there can be detachment of the layers or for vitreous humor. So that is how we're going to see there will be different changes which are normally will be found out among the client with the aging process. Next, we are going to learn about the auditory system and related changes. So here we're going to see external ear, middle ear, even the inner ear will be getting affected with the aging process. And these changes are very commonly seen among the older population. First, we are going to see the changes which will be occurring often in the external ear. It includes the increased production and drying of the cerumen. So, impacted cerumen, which will be ultimately potentially causing the hearing loss, can be present or can be found out among the client very often. The next condition is increased hair growth. So there will be visible hair, especially in men, generally with the aging process into the external ear. Next is losing the elasticity of the cartilage, which will be ultimately causing collapsing of the ear canal. So these are very common findings among the older individual. Next, we are going to see the changes into the middle ear. Basically, in middle ear, we are going to see the atrophic changes will be occurring into the tympanic membrane of an individual, which will be ultimately causing conductive hearing loss. That is the reason we are going to see most of the people with the aging process, they will be losing or they will be having low ability to hear. Now, also we are going to see there will be often presence of conductive hair loss. Although nowadays it is treated with some external devices, but it is a very common finding among the older population. The next one is the changes in the inner ear. Here we're gonna see degeneration of the nerves and the lack of blood supply or reduced blood supply is very common. So basically we are going to see that the client will be often complain about decreased sensitivity to high pitched sound. There will be impairment in the speech even sometimes. Tinnitus are very commonly complained by aged population. Even we are going to see presbycusis will be developed in a person with old age. Even in the inner ear, the vestibular apparatus will be acting in a less effective manner. That is when there will be alteration in the balance of the body and orientation. That is how most of the older individual will be complaining about losing of their body balance, and they will be often complaining about the feeling of dizziness. So this is also can be a reason where there will be less effective vestibular apparatus or disorientations of the vestibular apparatus. Next, we are going to learn about the changes which will be occurring in the integumentary system. So basically here we are going to see there will be decreased subcutaneous fat for individual with the aging, as well as there will be muscular laxity will be present for almost every individual. Degeneration of the elastic fiber is very common finding. Even the person may show collagen stiffening associated with the integumentary system. Because of all this effect, we are going to see there will be increased wrinkling of the skin, as well as the breast will be almost having a saggy nature. Even sagging of the abdomen is very common among the older population. We often will be seeing on the assessment that there will be slowness of the skin to flatten when it is pinched. So decreased extracellular water also will be very common among the older population. That is the reason they will be present with often a dry and flaky skin with possible sign of excoriation which will be caused by scratching. Even minimal scratching can sometimes cause excoriation. This older adults will be having a very high risk for the development of dehydration due to extracellular water loss. Even there will be decreased activity of apocrine and sebaceous gland, which ultimately will be leading to the development of dry skin with minimal or no perspiration. We are going to see there will be increased capillary fragility even, which will be often causing the bruising development in an individual's body. There will be increase in the focal melanocytes development. Diminished blood supply often will be present, which will be ultimately decreasing the rosy appearance of the skin and mucous membrane within individual. The skin often will be cool and clammy on touch for a older individual. A person often will be showing or will be present with the aging process with a decreased proliferative capacity. That is the reason there will be a diminished rate of wound healing for all the old age people. There will be decreased immunocompetency even for the client. That is the reason there will be increased chances of the development of infection in neoplasm. We will be seeing the changes or common changes among the hair of the individual with the aging process. Now, these are commonly found while assessing the hair distribution for a particular old age individual. There will be decreased melanin and melanocytes. That is the reason often we are going to find that there will be development of gray or white hair. Next is the oil secretion will be decreased. That is the reason why often older individual will be present with scaly scalp. Decreased density of hair is commonly found out. Even cumulative androgen effect will be causing decreased estrogen level. Ultimately, it can cause facial hirsutism, where we are going to see abnormal hair growth on the face. Next, we are going to learn about the changes which will be occurring in the nails. Here, we are going to see decreased peripheral blood supply and increased keratin will be almost always seen in the older population. Decreased circulation into the periphery also will be a very common findings among the older individual. That is the reason why for every individual we are going to see a thick and brittle nails with diminished growth of it. There will be prolonged return of the blood to the nails or on blanching. So this is the major common assessment findings that will be noted while assessing a older individual. Next, we are going to learn about the changes that generally occurs in respiratory system. Here we are going to see the chest wall stiffening is a very common feature that will be present among the old age individual. That is the reason why often barrel chest appearance will be seen. Even kyphosis can be developed for our client with the aging process. Costal cartilage calcification is a very common finding. That is the reason there will be decreased chest wall movement even with the respiration. We're going to see there will be reduced elastic recoil. That is the reason there will be reduced chances of deep breathing and mucus secretion will be thick here. The next finding is the reduced chest wall compliances. And because of the reduced chest wall compliances, we are going to see there will be reduction in the vital capacity and increase in the residual volume of the lung for the older adults. So furthermore, findings on assessment often will be showing increase anterior and posterior diameter, and also we are going to see there will be decrease in the functional ability of the alveoli of the lung for a person with the aging process. We're going to see there will be decreased muscle strength as well as diminished breath sounds is very common finding among the older individual. So basically there will be decrease in the partial pressure of the oxygen, or often with older individuals we're going to see the partial pressure of oxygen will be decreased. Saturation of the oxygen also is more likely to decrease. Normal pH will be seen among the client, and partial pressure of the carbon dioxide often will be showing a normal value. So as a defense mechanism of respiratory system, we often gonna see the older individual will be present with decreased cough effectiveness. So cell immunity and specific antibody production and generation and their function also will be disturbed here. The functions of the cilia will be getting disturbed. The force of the cough will be generally reduced for the older individual. Alveoli macrophages functioning will be disturbed here, and there will be disturbed sensation or activity of the pharynx as well as larynx of an older adult. Due to the decreased activity of pharynx and other associative organs or structures of respiratory system, we're going to see there will be decreased secretion clearance for our individual. Often a person with old or increased age, we're going to see they will be having increased risk of upper respiratory aspiration. That is the reason our older individuals often will be having more likely to develop with infection, influenza or pneumonia and associative disorders. So as the respiratory system is going under certain change, there is a reason we're going to see our older adult will be having high risk to have acid base imbalance development for their body, as well as the bodily response will be decreasing here towards the hypoxia, even hypercapnia for an individual. There will be decreased in the partial pressure of the oxygen and increase in the partial pressure of carbon dioxide. That is the reason older adults, if not managed well, often will be showing the feature of the presence or the development of acidosis. Retained secretion will be very common among the respiratory tract and respiratory tract infection related cases. Often, a person will be having increased chances of the infection related to the retention of the secretion. Next, we're going to see the hematological changes among the older adults. So here, basically, we're going to see the hemoglobin possibly will be slightly decreased for men and women. Mean corpuscular volume will be showing a slight increase in their level. We're often going to see the mean corpuscular hemoglobin concentrations will be slightly decreased, and the white blood cell count will be diminished to the response to the infection. So often we are going to see, even though there is presence of infection for our older adults, the white blood cell count will not be having or not be showing an elevation. So this is basically suggesting that the effectivity of the white blood cells here will be diminished. The next is platelets. So often we're going to see the increase will be, or the platelets will be increased with their adhesiveness. Clotting factor will be going under certain changes. So often we are going to see partial thromboplastin time will be decreased here, and fibrinogen and factor 5, 7 and 9 may be elevated. The ESR or erythrocyte sedimentation rate often will be increased slightly among the older individuals. D-dimer test often will be showing a elevation if it is done for an older person. Serum iron and erythropoietin often will be showing a decreased level in the body of old age people. Cardiovascular system associated changes are also very common among the old age population. We're going to see related to the heart there will be certain changes. Generally, there will be increase myocardial hypertrophy, which will be ultimately decreasing the cardiac reserve, and heart failure can very commonly develop among the older adults. Decrease in the cardiac output, decrease in the heart rate and stroke volume, response to exercise and stress, or intolerance to the exercise often will be seen among the older adults. There will be slowed recovery from the activity even if they are performing some moderate to intense activity or exercise. That is when we are going to see the person's heart or the cardiovascular system will not be adaptive enough of tolerant enough towards the intense or moderate activity. Cellular aging and fibrosis of the conduction system within the heart will be very commonly found out with the aging process. So that is the reason there will be decreased amplitude of the QRS complex on electrocardiography with old age people. There will be often increased length of the PR, the QRS, and the QT interval will be visible among the individual with a aging process. Valvular rigidity often would be shown among or often would be seen among the client with old age because of the calcification. There can be presence of sclerosis and fibrosis even, which will be often causing the development of systolic murmur among the older individual. Now we are going to see certain changes into the blood vessels. Often we are going to see the arterial stiffening will be caused because of the loss of elastin from the arterial wall. Even there will be thickening of the intima into the blood vessels. Progressive fibrosis will be seen among the media, and which will be ultimately causing increase in the systolic blood pressure among the older individual. There will be increase or decrease in the diastolic blood pressure even. Venous tortuosity is a very commonly seen phenomenon among the older population. That is the reason why majority of the older people will be having high risk to develop varicose vein and associated symptoms. Now we are going to learn about gastrointestinal system and associated changes. Here we are going to see there will be often decreased test bud among the client who are having a old age or who are having increased age. There will be decreased sense of smell even. Decreased volume of saliva production also will be seen among the client. That is the reason most of the old age people will be complaining about anorexia or loss of appetite often. Atrophy of the gingival cavity or gingival tissues are also very common findings among the individual. There will be often presence of dry oral mucosa. There will be difficulty in the chewing. Often older individuals will have to use the dentures, and dental implants will be there. That is the reason the halitosis and infection development within the mouth or oral cavity is very common among the older population. For esophagus, we are often going to see with the aging process, the lower esophageal sphincter will be having decreased pressure. Epigastric distress often will be seen among the client. Dysphagia, hiatal hernia are very commonly found among the older population. Aspiration also is a very common feature among the older individual. As we have learned, the lower esophageal sphincter will be losing their tightness or pressure. Related to stomach, we are often going to see the food intolerance is a common feature among the older population. That is the reason most of the old age individual will be asked to maintain a very soft and easily digestible diet, as well as less and frequent dietary intake. Lower gastric emptying and cobalamin malabsorption often will be found among the client. Next, we're going to learn the difficulties or the changes which will be seen among the small intestine and its activity. Often the client will be complain about indigestion. There will be slowed intestinal transit and delayed absorption of the food products from the intestine. We're going to see liver also will be decreased their ability to metabolize drug and hormone. Even there will be decreased protein synthesis from the liver. Large intestine will be showing a decreased motility. Even there will be production of excessive flatulence. Abdominal distension often will be found among the older individual. Because of the relaxed musculature, often a person or often an older individual will be complaining about the development of fecal impaction, fecal incontinence, and constipation. Pancreas also will be going under changes. That is the reason there will be decreased glucose tolerance will be seen among the older individual. Even there will be impaired fat absorption with the client's body will be seen with the aging process. Now we are going to read about the changes that are taking place in the urinary system. So basically here we are going to see the kidneys will be having certain changes. There will be decrease into the creatinine clearance. There will be increase into the blood urea nitrogen level. Increase serum creatinine also will be seen among the client. There will be decreased amount of renal tissues and the activity of them also will be decreased in case of older individual. There will be decreased function of the loop of Henle and tubules of the kidney. That is the reason there will be alteration into the drug excretion. Often the client will be present with nocturia. Loss of normal diurnal excretory pattern will be disturbed for older individuals. Stress incontinence, increased frequency and urgency, nocturia almost always will be complained by our older individuals. We are going to see next about the changes related to the endocrine system. Here, as there is atrophy of the thyroid gland, often we're going to see the T3 and T4 hormone secretion will be decreased, as well as the thyroid stimulating hormone production also will be depleted for older individual. Parathyroid hormone, or there will be increased secretion of parathyroid hormone and increased basal level of parathyroid hormone will be present for our older individual. Ultimately, this will be increasing the calcium reabsorption from bone, and which will be ultimately increasing the development of hypercalcemia and hypercalciuria among the older adult. It is a very common finding among the aged individual. Adrenal cortex also will be going under fibrotic changes and that will be reduced in their size. That is the reason there will be decreased metabolic clearance rate for glucocorticosteroids. Decreased metabolism of cortisols will be seen among the older adult. Decreased plasma level of adrenal androgen and aldosterone often will be seen among the older individual. Adrenal medulla, we are often going to see the basal level of norepinephrine will be increased, as well as the secretion of the norepinephrine will be increased from the adrenal medulla. No changes will be present for epinephrine into the body, or their basal level or the plasma level will not be changed here. Decreased responsiveness towards the beta adrenergic agonist and receptor blockers will be seen among the client with old age. Now, pancreas also will be going under degeneration. That is the reason we are going to see this changes into the pancreas may partly contribute to the increased incidence of diabetes mellitus with advanced aging. That is the reason most of the older adult will be complaining or will be present with the diabetes mellitus. which will be actually increasing the glucose level by decreasing the insulin sensitivity in the body. It is occurring because of the fibrosis process and the fatty deposition which is occurring in the liver cells. So often we're going to see the changes into the gonads as well. The woman will be having decreased secretion of the estrogen, as well as men will be having decreased secretion of testosterone with the aging process. So now we are going to look into the changes which will be occurring into the reproductive system. Often we're going to see client, mainly the male client with old age, will be having problem related to the prostate. Often there will be development of benign hyperplasia into the prostate. Decreased testosterone secretion is also very common, as I have mentioned before. In case of women, we are going to see there will be vaginal tissue atrophy will be commonly seen among the client. There will be decreased muscle tone, and alkaline pH is commonly seen among the vaginal area. That is the reason most of the old age female will be complaining about vaginal irritation, as well as increased frequency of vaginal infection episodes. We are often going to see there will be changes into the urethra even. That is a reason often there will be decreased muscle tone of the urethra. That is why a woman may complain about urinary incontinence and urinary urgency and increased frequency. We're going to see uterus also will be going under changes. So there will be decreased thickness of the myometrium. There will be definitely decrease in the size, and uterine prolapse can also occur if a woman is having multiparity. Now we are going to see basically here the woman will be completely stopped with their ovulation and menstruation cycle with the aging process. So here we are going to see often the changes related to the ovaries. So often there will be decreased ovarian function will be noted among the client. So basically we are going to see non-palpable ovaries will be there, and decreased size will be noted with the increased age for the woman. Changes will be often seen among the nervous system. So there will be decreased blood flow and metabolism basically into the central nervous system, basically into the brain, which will be ultimately leads to the alternate level of functioning. There will be decreased efficiency of the temperature regulating mechanism. There will be impairment in the ability of the adapt to the environmental temperature for those clients with increased age. Peripheral nervous system often will be disturbed or altered for the particular individual with the aging process. We are going to see the cranial nerve and the peripheral nerves will be showing decreased reaction time in specific areas or in specific scenarios. There will be definitely decreased level of speed and intensity of the activity of the individual. The reflexes will be sluggish, and there will be slowing of the reaction time with the aging process. Orthostatic and systolic hypertension will be very commonly found among the individual with old age because of the activity of the nervous system. There will be definitely disturbance even into the sleeping pattern. The next one is the changes in the musculoskeletal system. So definitely there will be decreased muscle strength and muscles. Abdominal protrusion often will be found out. Flabby muscles are commonly seen among the individual in case of old age. There will be increased rigidity of the neck, slow reaction time, even reflexes will be slowed down due to the inactivity of the musculoskeletal system. There will be decreased fine motor activities and slow reaction time and reflexes. Joint stiffness are often complained by the client with old age. There will be decreased mobility, limited range of motion, and also the client will be almost always complain about pain with motion due to the joint stiffness. Loss of height and shortening of the trunk will be occurring from disc compression among the older individuals. Loss of height and deformities often will be occurring because of due to the vertebral decompensation and degeneration even. Often the client, due to the stiffness, will be complained regarding the back pain, and the stiffness in the bony prominences will be complained. There will be risk of or high risk of development of osteoporosis within the older adults. So I hope till here we have discussed regarding all of the possible changes that are commonly seen or assessed among the older individual. I hope you understood the concept. Now, through reading this, you will be able to recognize now what are the pathological changes is taking place among the individual with the old age and what are the physiological changes is taking place. Also, we will be understanding by assessing the sign and symptoms that whether it is giving an indication that the person are going to develop certain disease condition or not. Through this, we will be able to assess our older individual in a very effective manner, and we will be definitely able to recognize any early sign and symptoms for any complication and disease process development. We will be also able to initiate the treatment earliest, as well as we will be also able to prevent the disease progression and complication development. So I hope you enjoyed the session. We will be seeing about the special older adult population and group as well as the nursing care towards it in the next session. Thank you so much for attending this one. We'll meet you guys in the next session.